Let's dive into dental implant pricing. A single-tooth dental implant cost can range anywhere from $150 to $300 a month. This cost can be determined whether you need an extraction, bone graft, or the type of material used for the crown. The choice of material and degree of customization play a significant role in the cost. The components for a single dental implant include a titanium body implant. This is the screw that gets placed into the bone. The second component is the abutment, what connects your implant to the crown. The third component is the crown, which finalizes your dental implant. The price for full mouth dental implant restoration can range anywhere from $300 to $600 a month. Now, a few factors that can influence this is determining the material that gets used for your arch. Are you looking for 2 arches? And what's your ultimate goal? We want to make sure that you're educated in making this decision and knowing all of your options that fit within your needs and your budget. So, few factors that come into play with this. Are you looking for a fixed option or are you looking for a removable option? We do have what's called an overdenture, most commonly referred to as a Snap-on denture. What this is a denture that gets snapped into 2 titanium body implants that get placed per arch. Now, the benefits with this is it does reduce your monthly cost and it still gives you the option of being implant retained. Now, the overdenture can range anywhere from about $8,000 to $12,000. With that option, we do have monthly payments that can also be determined upon coming in for an in-person dental implant consultation. So, what is All-on-4 and what is All-on-6? The difference between the two is ultimately determining what's going to be best for your overall bite. Now, All-on-4 means that you have a single unit appliance that follows your arch that is held by 4 titanium body implants. The second thing is All-on-6. The determining factor for this is what do we need to stabilize your bite? That's where that 6th or any additional implants can come into play. The last factor that we do have to consider is zygomatic implants. Zygomatic implants are needed when there is a severe loss of bone on your upper arch. This means that we need to use a little bit more of your bone structure to engage those implants and have a good outcome. 2 things that can help reduce your monthly payment are your dental insurance. How can we maximize your benefits to help you achieve your goal? Second thing is, do you have a down payment? These are 2 different factors that can help influence that monthly cost. We do understand this is a contribution towards your health. This, at the end of the day, is to ultimately achieve a better quality of life. We hope this video was helpful for you to understand the factors that come into play to determine the cost. If you have any additional questions, please schedule a consultation and we hope to see you soon.